Tonight, I want to share with you something that could truly change how you feel by tomorrow morning. If your feet and ankles swell and your shoes become tight, if pressing on your skin leaves marks behind, or if your legs feel heavy and tired, it's time to learn a proven routine for bedtime that helps get rid of this fluid. But it's important to remember, foot and ankle swelling, especially as we age, isn't just a small discomfort. It's a sign your body wants your attention. Sometimes the usual solutions might not help, and in some cases, the right approach can really make all the difference. For many years, I've helped older friends and family manage swelling. I've seen what works and what doesn't. In this video, I'll give you a simple way to figure out your type of swelling, practical evening routines for each situation, a list of common medications that may be contributing, and crucial warning signs that signal when it's important to see a doctor, sometimes right away. Everything here is practical, safe, and something you can put into action immediately. Let's begin by understanding that not all swelling is the same. There are 5 main types, and the best solution depends on the cause. Type 1. Dependent swelling. This type often appears after sitting or standing for a long time, as gravity pulls fluid down toward your feet and ankles. The body sometimes struggles to return this fluid back up, especially as we get older. If you notice swelling that gets worse as the day goes on, but is better after a night's rest and affects both feet evenly, you're likely dealing with this common issue. The good news, it's often the easiest to improve. Type 2. Vein circulation issues. If the valves in your leg veins weaken, blood flow may become sluggish, leading to swelling, sometimes more pronounced in one leg than the other. You might notice aching, tiredness, or even visible veins and skin color changes. Elevating your legs can help, but you'll need other techniques too, like gentle compression and certain exercises, which I'll explain later. Type 3. Lymphatic swelling. Sometimes the body's drainage system, the lymphatic system, struggles to move extra fluid. This results in swelling, often starting in the feet and slowly moving upward. The skin might feel tight or thick, and pressing on it leaves a dent that doesn't disappear quickly. People who've had certain surgeries, radiation, or infections may notice this kind of swelling. Type 4. Medication-related swelling. Many standard medicines can cause fluid to build up as a side effect. Some blood pressure medications, pain relievers, steroids, and even certain diabetes treatments are common causes. If your swelling began or worsened within just a few weeks of starting something new, it's wise to look into whether a prescription might be contributing. Usually the solution is to consult your healthcare provider about alternatives, rather than rely solely on elevation or compression. Type 5. Heart or kidney-related swelling. When the heart or kidneys aren't working at their best, fluid often builds up. With this type, swelling is usually in both legs, can rise up toward the knees or even thighs, and you might also feel extra tired or notice changes in urinating. This is not the kind of swelling to ignore or try to fix on your own, and it's important to reach out for medical support as soon as possible. How to tell what kind of swelling you have. There's a simple test. While seated, press your thumb firmly into the front of your shin for about 10 seconds. When you release, check how long the dent remains. If it lasts more than 10 seconds, this is called pitting swelling. This rules out certain types, like problems with the lymphatic system, which usually do not leave a dent like this. Now compare both legs. If the swelling is similar on each side, it's often due to gravity, medications, or the heart-kidneys. If one leg swells much more, especially if it has come on suddenly, this could be something more serious like a blood clot and should be checked by a doctor without delay. Always consider timing. If swelling worsens as the day passes and gets better in the morning, it's likely because of gravity or mild vein problems. If swelling is persistent or happens overnight as well, especially alongside tiredness or trouble breathing, a heart or kidney cause should be considered. Before we move forward, I want to stress a few important warning signs you should always pay attention to. If swelling appears suddenly in one leg, is painful, red, or feels noticeably warmer than the other, this can be a serious signal, possibly a clot, and you should not wait or try to treat this at home. Immediate medical help is vital in these cases. If you ever have swelling in your legs along with chest pain or severe shortness of breath, that's another warning sign to seek help quickly. Sometimes, swelling is the first indication something deeper needs your attention. Remember, it's always better to get things checked early if you're unsure. There's no harm in double-checking your health. For most people who experience gradual or long-lasting swelling without those emergency warning signs, let's talk about a powerful routine that can bring real relief overnight. This bedtime process involves 5 important steps that work together to help your body move fluid out of your legs safely and comfortably. Each detail here matters, so I'll be clear about how and why to do every part. Step 1. Correct elevation of your legs. Many people prop up their feet, but often not high enough to truly help. For gravity to assist in draining fluid back toward your core, your legs need to be elevated above your heart level, at least a full 12 inches. This is best done using a firm wedge or several pillows that support your legs from ankle to thigh, keeping the whole leg at an angle of about 20 to 30 degrees. Knees should be slightly bent for comfort, and it's important to keep this position all night, not just for a couple of hours. When this is done properly, the body can work naturally to move extra fluid out of the legs. Don't be surprised if you need to get up to the bathroom more often during the night. This is a good sign the method is working, as your kidneys are filtering and removing the fluid your body doesn't need anymore. Step 2. Compression stockings. For daytime use. Compression is best used during your waking hours, not at night. Special graduated compression stockings, tighter at the ankle and looser further up, help prevent fluid from collecting in the legs throughout the day. For mild swelling, choose a lower-level compression. For more serious cases, or if your healthcare provider has diagnosed vein problems, ask about a higher grade. Always make sure the stockings fit well, not too tight and not too loose, and put them on first thing in the morning before getting out of bed. This stops gravity from letting fluid build up right from the start of your day. Wear these stockings all day and remove them before bed. Regular washing and replacing every few months is important so they don't lose their strength. Good stockings are an investment in your comfort and long-term leg health. Step 3. Lymphatic massage. Before bed, you can use a gentle massage technique to move fluid manually. This isn't deep tissue work. The aim is soft, light strokes that follow the direction of your legs up toward your groin, where major lymph nodes are found. Begin at the thigh, then knee, then lower leg, finishing with the foot. Use gentle pressure, enough to move the skin lightly but not to cause discomfort, repeating the sequence for about 5 minutes in total. Doing this each night right before elevating your legs helps prepare your body's own drainage system to work more effectively throughout the evening. Step 4. Smart hydration. It's easy to think that drinking less would reduce swelling, but in reality, proper hydration actually helps your body let go of excess fluid. Focus on having enough water earlier in the day, cutting back in the evening, especially the last 2 hours before bedtime. This helps your kidneys work efficiently while reducing the chance of having to get up too often at night. At the same time, reducing foods high in sodium is vital, as salt can make the body hold on to water. Homemade meals with less salt, plenty of vegetables, and using herbs for flavor can make a dramatic difference within just a few weeks. Step 5. Support with nutrition. Some supplements and foods can help manage how your body balances fluids. For example, magnesium supports healthy circulation, and potassium-rich foods, such as bananas or potatoes, help maintain fluid balance while cutting down on salt. Certain natural plant extracts can also be helpful if you struggle with circulation. Focus on real foods first and only use supplements if you know they are safe alongside your current medicines. Let's move on to your complete nightly routine. A step-by-step guide you can begin using tonight to encourage healthy circulation and comfort. Evening protocol for reducing swelling. 6 p.m. Have a low-sodium dinner. Focus on fresh, unprocessed ingredients and avoid adding extra salt. 8 p.m. Stop drinking large amounts of fluid. If you need small sips with medications, that's fine, but try not to drink much after this hour. 9 p.m. Perform your gentle 5-minute lymphatic massage, starting from your thighs and moving down toward your feet, always massaging upwards to support fluid movement. 9:15 p.m. If recommended, take magnesium, 400 milliliters of magnesium glycinate. And for those with blood vessel issues, consider a standardized horse chestnut extract, only after ensuring it doesn't conflict with your regular medicine. 9:30 p.m. Prepare your bedding. Arrange pillows or a wedge to keep your legs 12 inches above your heart at a gentle angle. This may feel awkward at first, but after a few nights, your body adjusts. You may find it helps to use a body pillow or extra support to keep you stable and comfortable. Before sleeping, make sure the room is dark, at a cool, comfortable temperature, and without screens to promote restful sleep. During the night, it's perfectly normal if you wake up needing the restroom more often. This is just your body's effective release of extra fluid. Morning routine. When you wake, before getting out of bed, put on your properly measured compression stockings straight away. This stops gravity from bringing fluid back to your ankles as soon as you get up. Then go about your day as usual. Consistency is key. For best results, try this full protocol every night for at least 2 weeks before expecting to see its maximum effect. Often, people feel noticeable improvement within the first several days, with more dramatic progress showing up over longer periods. Occasionally skipping the routine, unfortunately, won't have the same impact. You need steady, repeated attention to help the body reset its fluid balance. What if special circumstances are present? Trouble sleeping with legs elevated. If it feels odd at first, start with a gentle slope and work up to the full elevation as your body adjusts. Using enough cushioning under your legs and lower back can increase comfort. Joint or back pain. Experiment with side-lying positions with pillows, or consider lumbar support if needed. If elevation isn't practical night after night, focus on daytime compression and gentle massage instead. Already taking diuretic medicines. It's safe to use this protocol together with prescribed diuretics unless advised otherwise. These approaches work in different ways. Medicine helps the kidneys eliminate fluid, while elevation and compression help move fluid from the legs so your body can process it. Heart or kidney concerns. While this routine may help with comfort, it doesn't replace professional care. Always follow your doctor's instructions and be attentive to changes, especially if you notice worsening symptoms or sudden weight gain. In the next part, I'll cover real-life examples, common fears, persistent myths about fluid balance, and your final checklist to help you start right away. Let's now look at real examples of how these routines have helped others, address common concerns, and put together a simple action checklist you can follow. Real experiences from people like you. Many have seen improvements by faithfully following these steps. For instance, one person struggled with swollen ankles after starting a new blood pressure medication. By working with their healthcare provider to adjust the medicine, while also using nightly elevation and daytime compression, the swelling resolved over a few weeks. Another individual dealing with tired, heavy legs from poor vein circulation noticed less pain, lighter legs, and even an improvement in skin color after several weeks of combining all of these methods, especially when sticking strictly to lower salt intake and regular massage. Even for those managing conditions like mild heart problems, adding simple changes such as leg elevation and smart hydration made daily life more comfortable, allowing for more movement and easier fitting shoes. The underlying health challenges didn't disappear, but with steady use of these routines, the quality of life improved noticeably. Common questions and concerns. One worry is that reducing swelling too quickly or combining various methods might cause dehydration or low blood pressure, especially for those already taking water pills. The natural techniques we've talked about, elevation, massage, and compression, work gently and safely, encouraging your body to eliminate only what it doesn't need. If you're using prescribed diuretics, it's wise to let your doctor know about any new results, since your medication dose may eventually need adjusting. Another question comes up about limiting water. Some believe drinking less will reduce swelling. In fact, cutting your fluid intake can make the problem worse, as the body holds on to water when it senses dehydration. Instead, drink enough water in the first half of the day, focusing on reducing sodium, and trust your kidneys to balance fluids effectively. You might also wonder about sweating out swelling with sauna use or very intense exercise. While gentle movement is generally good for circulation, trying to remove fluid through heavy sweating isn't advised, especially for older adults or those with existing heart concerns. Excessive sweating can actually prompt the body to store more water in response. Serious warning signs to watch. for it's always important to know when swelling signals something more urgent. If you notice sudden and significant swelling in just one leg, especially accompanied by pain or redness, seek care right away, as this can be a sign of a blood clot. If your swelling comes on quickly in both legs and is accompanied by breathing problems, or if you see broken, oozing, or infected areas on the skin, don't delay getting help. Any new symptoms like abdominal swelling, yellowing skin, or confusion are also reasons to reach out for a medical evaluation. For chronic, even swelling without these urgent symptoms, especially when you can identify likely causes such as veins, mild heart or kidney issues, or reactions to medications, the combined methods described here are both effective and safe for home use. Let's finish with a step-by-step checklist and a few important reminders so you have everything you need to start feeling better tonight. Your action checklist: identify the cause. Use the guidance from earlier in this video to figure out what's likely causing your swelling. Pay attention to whether both legs are affected when the swelling occurs and if there are any other new symptoms. Rule out emergencies. If you spot any of the warning signs I mentioned, especially sudden, painful, or one-sided swelling, shortness of breath, chest pain, or infection, reach out for medical help immediately. Review your medications. Take a moment to look over all your prescriptions and over-the-counter medications. If you notice swelling that coincides with starting something new, talk to your healthcare provider about possible alternatives. Prepare for elevation. Make sure you have a sturdy wedge or enough firm pillows to comfortably raise your legs at least 12 inches above your heart. Get compression stockings. If you don't already have them, measure your legs properly and purchase medical-grade compression stockings in the recommended pressure for your needs. Gather supportive supplements. If appropriate, have magnesium glycinate ready, 400 mg for most adults in the evening. And talk to a health professional about safe options if you're considering plant-based supplements for vein support. Adjust your diet. Start today by reducing sodium as much as possible. Avoid processed and salty foods. Cook with fresh ingredients and limit added salt. Hydrate wisely. Drink most of your fluids earlier in the day, gradually reducing intake several hours before bedtime. Do the massage. Take 5 minutes each night before bed to perform a gentle, upward lymphatic massage as described above. Maintain the protocol. Follow each evening step, including taking supplements and keeping your legs elevated throughout the night. Start mornings. Right. Put on compression stockings before getting out of bed every morning. Be patient and consistent. Keep with this approach every night for at least 2 weeks before fully judging your results. Improvement can often be seen sooner, but real, lasting progress takes continued effort. A few final thoughts. If your situation feels complicated, if you have multiple chronic conditions, unusual medication needs, or mobility challenges, don't lose hope. Small, regular steps can make a real difference. And remember, when in doubt, personalized guidance from a professional can help you adapt these routines safely. It's easy to see swollen feet and ankles as just a part of aging, but in reality, they're signals from your body. By listening, acting, and taking care each night, you not only improve your comfort and movement, but also guard your overall health, including reducing the risk of falls and other complications. Be patient, care for yourself, and remember, your feet have supported you through countless journeys. They deserve your attention now. Start this protocol tonight and take a positive step toward feeling lighter, healthier, and more at ease in your daily life. If you found this advice valuable, consider subscribing to this channel for more practical tips and support. Share this video with friends or family who might benefit, and let us know in the comments which approach you plan to start with or any questions you have. Taking action today could make a real difference for you and those you care about. Take care and be well.